watching Daybreak. Thank you for staying with us. The hashtag on X is Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. In 2 days' time, the world will be marking the World Blood Donor Day, an important initiative that two stakeholders are with me here to give me their account of its relevance, its importance, and why blood donation is key. On my immediate right is Ruben Tulel. He's the head monitoring and evaluation, the Kenya National Blood Transfusion and Transplant Center. Good morning.
Good morning.
Thanks for your time. Lovely to have you. John Muraidi is the chairperson and the founder of O Negative Kenya and a regular blood donor. Gentlemen, your time is all appreciated. First, yes. John, may I begin with you? And you founded the O Negative, an organization?
Yes.
Why? What's the rationale? What's the reason behind that?
I came there sometimes 2018. That's when I came to know I'm O Negative in the year 2014 when I donated for the first time when Kenyan BTS had a tent at Kencom. And then later on, passing through the same area, I went for my card and I came to know I'm O Negative, and which is a rare blood group. And the drive to form this is because I came to know many people may be in need of this rare blood O Negative, but they can't get it. So from 2018, we formed the group, and we try to respond to blood appeals for those who are in need of negative blood groups, because they are very, very rare. My drive was to see more lives saved, not see people die because of lacking this rare commodity, hence the formation of the same.
Yes. Is it as a result of scarcity?
One, O Negative is very scarce, very rare. If you go to our blood banks, mostly they may have other, probably the positives, but when it comes to the negatives, they can't, because the National Blood Kenya National Blood Transfusion, being the national blood bank, you can imagine they sometimes even call me to come and to get donors to help on the same, because that they come to a point they don't have the blood in their blood banks.
Yeah, and in a sample, maybe in a number, in terms of getting in a number of 10, 20, how many people? Say, what's the possibility in terms of the percentage of someone with blood group O Negative?
O Negative is approximately about 5% of the population.
Yeah.
Yes.
Which is
and the funny thing, in that's 5% of the population, the majority of who knows they are positive, they are O Negative, are women. And you know, for sure, women, they cannot help each and every time. So, because sometimes you may need help from them. Maybe they may be pregnant, they may be breastfeeding, which eliminates them from dominating. And also, probably they may be experiencing the monthly periods, which also eliminates them.
Yeah.
So, because in my group, I think 70% are women. So, it's a big problem.
Yeah. Okay, Ruben, coming to you. So the world will be marking the World Blood Donor Day in under 48 hours' time on the 14th.
Yes, yes.
Why is this day important before we come down and discuss it at the country level?
Thank you, Ayub. I think first I wish to really take this opportunity to thank our blood donors, as the theme of this year is that we are celebrating 20 years of the commemoration of the World Blood Donor Day. And our theme for this celebration will be 20 years of celebrating giving. Thank you, blood donors. So as the Kenya National Blood Transfusion Service and Kenya National Blood Transfusion and Transplant Service, we are excited and celebrating our blood donors. It is important that maybe we get a historical perspective of the World Blood Donor Day celebration. Kenya being a signatory of the World Health Assembly resolutions, in the year 2005, all the cabinet secretaries of ministers of health globally met and made a resolution that we will be celebrating World Blood Donor Day every 14th of each year, of June each year. And this being our 20th commemoration then, it is a day to celebrate blood donors. It is a day to say thank you to blood donors. Just as my counterpart has mentioned, that it is quite a challenge to get some of these blood types. You can see, Ayub, that probably may be knowing that 15% of the world population are rhesus negative. So that is world population that is rhesus negative. So then that makes it very difficult. In any time when you have a patient who's a rhesus negative patient, then it becomes a challenge in getting blood for this patient. And I want to thank John, and we've interacted before, and he's done a very good job in terms of mobilizing rhesus negative blood donors. So my appeal, and our appeal as the Kenya National Blood Transfusion and Transplant Service today, is to urge all Kenyans that it's important to know your blood type. Just as is mentioned, women have more chances of knowing their blood types than men. Okay. Because, one, of course, when they go for the antenatal clinics, they are usually given their blood types. But when it comes to us men, until when we decide to donate blood, that's when we get to know our blood types. So one appeal that we are making as an agency is that Kenyans need to know their blood types. It's a very important health information that you need to know.
All right.
Yes.
We'll talk about the processes as well and why we need to donate blood. But first, you come from the Monitoring and the Evaluation Center.
Thank you.
Give us the data in terms of the breakdown of the profile here, including the age and the general demography. How do we look like, and what's within then our blood bank?
Thank you. Thank you, Ayub. Just to speak on the numbers is that in the first 3 quarters of this financial year, 2023-2024, we've collected 259,000 units of blood, and of which these 259,000 units of blood, some have been converted to various blood components. You must have heard someone say that you can save up to 3 lives with 1 donation. So as a service, we've made available 312,000, slightly over 312,000 units of blood and blood components available for transfusion in the country. So we look at the national need. And therefore, I'll speak about the national need. But first, maybe on the demographics of blood donors in the country. Just to confirm what my counterpart has said about males being the largest proportion of blood donors in the country, it's true. Most of our blood donors are males. And one thing that I just want...
Yet they rarely know about their status.
Yes, yet they rarely know about their status, of course, the blood types. So, but one thing that I can say is that as a country, we are trying to transit into adult population being blood donors. So we are trying to move away from over-dependency on the, say, high school students to donate blood. So the age that is carrying the biggest proportion, the largest proportion of blood donors, is between 16 and 30. So this is because these are organized people in organized groups in terms of being in high school, being an institution of higher learning, in tertiary institutions. And that is where we get most of our blood donors. And you may note that we are looking at increasing the number of voluntary blood donation for reasons that are about safety. Okay, so as a country, we are emphasizing on voluntary non-remunerated blood donation. So as a national blood transfusion service, then we are trying to emphasize on these groups that are basically donating blood. So of course, the ages between 30 to 65 form part of our blood donation, but many
are they the majority?
No, the majority is between 16 and 30. Okay. Yes, those are the majority. The age that is really contributing to our majority blood donors. So for us now, the age between 30 and 65 are you and I. So sometimes we are busy. Sometimes unless we have a patient in hospital, maybe who requires transfusion, that's what we call family replacement donation. That is when you donate when you have a kin in hospital or a friend in hospital. So, but our appeal through the Ministry of Health and the National Blood Transfusion and Transplant Service is that we want to encourage Kenyans to be voluntary blood donors. And we are trying to provide with strategies on how one can donate blood conveniently.
Okay. You call upon Kenyans to come out and donate blood. John, why then is it important to donate blood?
One, as my counterpart has said, Ruben, one pint of blood can save more than a life. It can save up to three lives. And so when you donate, one is not just is an act of humanity. And then this blood we are given freely. There's nothing I have paid God to give me blood. So if I have enough, why not give for the one who does it so that we may save that life? Because sometimes we lose patients due to lack of blood. So it's a key thing to donate. It's not a must that you rush to the hospital when you have a patient. You have someone you know who is in need of blood. But just to know, because sometimes we may have some natural calamities which may arise. We had, this time we had just the other day we had a fire somewhere. This person rushed to the hospital. They may need blood. So unless there's blood in the facility, this person may die before getting the blood, because how this person who comes to the facility, there is no blood. How are you going to trace the relatives? At that time, you don't have blood, you may lose this life. So one key thing of having that initiative of donating blood is having the human in you, the human act of saving, knowing that when you donate, you will save a life.
All right. Given what we have talked about at the moment, then, Ruben, talk to us and educate our viewers on what we need as a country in terms of our blood reservoir, our blood bank. We have had cases of emergencies. For example, we had terror attacks. We had accidents that had claimed a lot of lives, and many ending up in hospitals, therefore the need for blood. Then what is the level needed as a country? And is that determined by our number as a population in terms of our demography and or the data provided of the ailments that many suffer from, which may inform the need for blood donation?
Thank you, Ayub. Just I wish first to begin to continue from where my counterpart has said, that the ideal situation is that let the unit of blood wait for the patient, but not the patient wait for the blood. So in that case, we need sufficient supplies of blood in the country to ensure that every Kenyan is safe. Remember, Ayub, that even as we sit here, we are all potential blood recipients and equally potential blood donors. So as a service, we are working towards ensuring access and sufficiency to blood transfusion services in the country. So just coming to your question then, is that how do we estimate the national need for blood? Okay? Just like many other countries in sub-Saharan Africa, data is something that is lacking in terms of estimating the exact need of blood in each and every country. So as a country, we are looking at our population. Remember, in the census of 2019, Kenyans were estimated to be around 49 million, but we are now getting to 53 million. So the World Health Organization guides on the minimum national blood need. Remember this word, minimum national blood need, in terms of how many units of blood do we need as a country to ensure that we are sufficient. But on this situation, minimum. Okay, so Kenya requires up to, for this population that is there, minimally we require around 530,000 units of blood. Okay, that's the minimum, but the need
annually. That's what
that is annually.
Yeah. So far we have in 2023-24 259. Yes. So that is way less. But they are still.
Yeah, they're still. Yeah. But one thing I want to say, Ayub, is that. Even as we look at the national need for blood and the demand for blood, let's remember that there is an increase in that demand because we're looking at management of patients who have non-communicable diseases like cancers. Medical surgical procedures require blood transfusion. Just emergency situations like my counterpart mentioned about the fires and all that. There are specific components that are required in these situations. So therefore, the national need may go as high. The national need may go as high as 1 million units of blood per year. So we are working on trying to really find out right now. We have even contracted consultancies to ensure that we know exactly how many units of blood and blood components we need as a country. In doing this, Ayub, we've applied some strategies through the leadership of the ministry and the National Blood Transfusion and Transplant Service. We've applied strategies to ensure that we achieve this, and we are going to achieve this in terms of ensuring the safety of Kenyans. Yeah,
and John, if we talk about, because there are questions that we are also receiving from our viewers, and some need specifications and clarification. Earlier on, we talked about women's cases, of course, special because they undergo natural biological processes. It can be breastfeeding, it can be their monthly menstrual period, it can be, of course, other circumstances that may exempt them from donating blood. How about other groups or persons who may be exempt, who may not be required to donate blood? Are there specifications around that?
Yeah, thank you, Ayub, for that. A quick question. There are some exemptions, because if you are beyond 65 years, you cannot donate, because that is the stipulated maximum age. And if you are below 16 years, you cannot donate. And also there are some ailments which may kick you, which, for a better word, which may eliminate you from donating. Like if you have some ailments like cancer, you have diabetes, and also the issue of blood hypertension, being hypertensive, may also eliminate you from donating. And also, there are some. On this, I think now when you go to for the facility, the questionnaire you fill, they have quite a number of questions they ask so that they may determine your eligibility to donate. You may go to a facility and probably you want to donate, but it is not possible. For example, you are drunk, you cannot donate. You have some hangovers, you cannot donate. Yeah. Yes.
You have to be active.
Yeah. You have to be active.
And how about the screening part of it? Because I have donated blood in some occasions, and it was majorly informed by the need that arose at the time. And what I realized from my observation was the screening process that the blood is taken through. So why is that done?
Thank you for that. I think the reason for the screening, the reason for the screening is this blood you are donating, it needs to go to a recipient, someone who is in need of it. And even if you fill the questionnaire and you say you are fit, there are some things probably you may be hiding, or there are some things you may not know. So this blood must be certified as safe to the recipient, because in case there is an ailment you have, you have and you don't know. So the screening process may certify this blood is now safe for donating. For the recipient to receive it. Yes.
And is also another reason, Ruben, coming to you, the staving off of the possibility of allergy, since this blood is then given to another recipient, and the possibility of an antigen-antibody reaction that normally takes place on the surface of the cells and produces a chemical substance called histamine. Is it also, does the screening prevent that?
Thank you, Ayub. I think just to continue emphasizing on what my counterpart has said, is that one of our core mandates is to ensure that the blood that we get in the country is safe for transfusion. And the screening process begins way early, even before you donate blood. So it's spoken about the eligibility procedure that you go through before you donate blood. We have a donor questionnaire that we usually administer. The administration of that questionnaire is part of blood safety measure in terms of ensuring that those that donate blood are safe. And equally, the questionnaire has the intention to also ensure the safety of the donor themselves. Because however much you may be willing to donate blood and maybe your health does not allow you to, then we now consider your safety as a service. So that process, there are around 3 steps that takes into having that questionnaire filled up. One of it is just to look at the general health of the donor. And the next thing is to look at what we call a health questionnaire, where now we look at how much blood do you have. And I'm glad to say that as a country, we've moved now from what we used to call qualitative testing of hemoglobin levels during our blood donor campaigns to quantitative, meaning, Ayub, today, if you come to donate blood, we'll be able to check your hemoglobin level and tell you are this. And for one to donate blood, you must have hemoglobin levels above 12.5 grams per deciliter. So that is the minimum that you can have. So the process begins from there. We also look at your lifestyle in terms of risk assessment. Again, remember what John said, that we are looking at the safety of the recipient. All this we do to ensure that the unit of blood we get from you will definitely be of benefit to the recipient. Yeah. So that process is what we call donor counseling. We provide for electronic counseling, where not really electronic counseling, but the filling of the donor questionnaire, you can do it at the comfort of your office, and then present yourself to donate blood. But coming to now the safety aspect and testing aspect of blood, the Kenya National Blood Transfusion Service and Transplant Service has ensured that we have a network of well-equipped laboratories where blood is tested. And the government, through the Ministry of Health, has ensured that there's enough investment in terms of the technologies that we use to test for blood.
And how many centers do we have?
Okay, thank you. Ayub, this is a number that is changing going into the future. We have 43 satellite blood banks in the country, which are distributed in all other counties. We have 6 regional centers, which we call regional centers of excellence, where now the testing of blood happens. So in total, we have 49 sites in the country. But as I said, we are looking into increasing the number of sites because, you see, Ayub, we are looking at providing an opportunity for every Kenyan to donate blood. We are looking at opportunity for every Kenyan to receive safe blood for transfusion. So we are looking at population. Remember, we said that our target is based on the minimum 1% population of every county. So in targeting, we are doing, let's say a county has a certain population, we do 1% of that population to say that that's the need, the minimum need for blood in that county. So we did a meeting with the county governments and the CECMs of every county, and we gave targets for every county. So this is to ensure that all Kenyans receive blood transfusion.
Okay.
Yes.
And John, we have talked about those who are exempt and at length. So what should I do and what should I not or avoid after donating blood?
One, the process of donating blood, the normal blood, the whole blood, the red blood cells, takes about 15 to 20 minutes. And after donating, you need to relax for some time, 15 to 30 minutes. After donating now, you sit somewhere and relax so that your body response may be, okay, for the body to respond fully to what has happened. And and also the same happens when also you donate pheresis platelets, when you donate through the process of pheresis machine, which now gets the blood components from your blood. The process takes between 55 minutes to 1 hour. So you can imagine being there, pumping blood for 1 hour. So after that, you need to relax a bit and wait for the body to respond. And sometimes, mostly we see when you donate, they give you some sodas and also maybe some snacks like biscuits. It's just to give you more glucose to energize your body system. Yes, to have a faster response on the same. Yes.
And Ruben, then after doing that, are people who have been vaccinated allowed to donate?
Thank you, Ayub, for that question. Vaccination is a very important health intervention, and depending on there are various types of vaccines where now determines the number of days maybe when you'll be exempted from blood donation. So depending on the vaccine that you receive, the longest, maybe if you receive a vaccine like a live attenuated vaccine, like chickenpox vaccine, then you will be exempted from donation for a longer period of time, up to 12 months. But for the normal vaccines that we do receive, including the COVID-19 vaccine, the deferral period is around 1 month for most of the vaccines. Okay. So I just want to urge Kenyans then that when one receives a vaccine, the reason I want to speak about a specific vaccination, that we are seeing it as part of what some of the education that we must give to Kenyans is that you see, blood for transfusion is tested for HIV, hepatitis B, hepatitis C, and syphilis. So when you get a hepatitis B vaccine, many a times if you receive a vaccine and then you go to donate blood, it may give a positive result for hepatitis B. But the thing is, you are not positive for hepatitis B, but it's because of the vaccine. Because how vaccines work is that they elicit some immune response, just like an infection. So if you receive a hepatitis B vaccine and you go donate blood, you're likely going to receive a positive hepatitis B test results, which means then that you are not safe to donate blood. And also, then our laboratory scientists may not be able to determine whether this is because of the vaccine or because of the infection. So again, we do ask our donors that once you receive a vaccine, we exempt you for like a month before you come back to the pool of blood donors. So that is about the vaccines. It is quite an important intervention, and therefore can affect blood donation, but of course the overall benefit is that we'll have safer blood donors. So the coverage of vaccination also is something that we want to encourage so that we can continue having safe blood donors in the country.
All right, and John, given what Ruben's submission, how then, because you have talked about the importance of having blood banks and reservoirs, how then can stakeholders and players like you inculcate a culture of unpaid or voluntary blood donation, given the times that we live in of new illnesses that are coming up and testing the limits of medicine, and also incidences that may as well prompt the need for blood banks and the swift response needed to respond to those who may be severely injured and are in need of blood donation. How can that culture be inculcated of unpaid and voluntary blood donation?
Thank you, Ayub, for that. I guess it's the time we went back to the basics and start donating, not because I want to gain, but because I want to save a life, and not a must to save a life, to donate to save a life of a person I know. Because it may be too late for you even to, if you want to respond to a person you know, it may be too late. About 2 years ago, there is a case I remember. I got a call at around 10 p.m. just know what I do is just charity work. So I'm employed 8 to 5, and then I do this during my free time.
Yeah.
Now, 10 p.m., I received a call of a patient who was in dire need of blood. And they needed at least 4 pints of O negative. Early in the morning, at that time I did not sleep. I just went to my database and tried to check who was eligible in the vicinity.
Yeah.
And I got 4 people. I called them very early in the morning because it was a bit late.
Yeah.
I dropped them a text, but called in the morning. Then I encouraged them to go donate to save a life. For sure they went. But too bad, before the blood was screened, we had lost a patient. So you can imagine,
yeah.
you may rush to save someone, but it may be too late. So is have that, the way my counterpart said, that it may, even we ourselves, we are potential recipient.
Yeah.
Just to know, if, at that time I want blood, will I get it in the facility? If I guess you have that kind of thought, then it may drive you to donate. And also is time, also we need, also charity the KNPTS. I know they are doing good on this sensitization, but also they can probably go a notch higher on this sensitization. These especially where we have these organized groups, so they can, especially these the age of 16 to 30, they can have tailor-made message of awareness to these kind of groups, so that, or even use some social media influencers, so that, there are these people they identify with some kind of influencers. So if they see this person in influencer on this and this campaign, they may join they may join the team. So, and also for we who are, for those who are 30 to 65, then they can also tailor-make a message for us. So to get more people, this message, it means that they may reach more people, because you see, if a message is tailor-made for you, you identify with the message.
Okay.
Then it means the message reaches you well,
yeah.
And also you can be able to disseminate the same to those who are in your circle.
To bring forward more people.
Yes.
Or to donate blood. So you mentioned that you have a database where you track people depending on the vicinity where you are, the proximity and the proximity to the patient. Then why not, there's, and take us through the process, because there is the aspect of refrigeration that is involved.
Yes.
Then why not from your database get these people donate that blood, since at the start point of your submission, you mentioned because of scarcity is why you formed the O negative campaign. Why not allow them donate, then refrigerate it, and take us through the processes, or that may not be the needed biological process to preserve the blood? Why depend on the list if they can donate and can be refrigerated, and if need be, then donate the blood faster?
Thank you for that. It's something I also been encouraging them to do. But still the culture we have. I have to donate the blood when there's someone who is in need. It's the culture we have built. Yeah. So there are those who donate when when they are eligible, they rush to a facility like KNPTS, because for sure each and every time we have the need for the blood, they donate, and then some call me and tell me, hey, I have donated. I think February, this person who donated in Eldoret at a BTC, and he called me and said, hey, John, I have donated at this facility. Kindly talk with, if there's one in need, kindly coordinate on that. So it's the culture we have. And since the culture is there, for now, we have to, that's why I'm doing the way I'm doing. Yes.
Okay. And maybe Ruben now can take us through that. What then happens, Ruben, from the point I get to the medical facility, my blood is taken, it's screened. So take us through up until it ends up in the body of the recipient.
Thank you, Ayub. I want to pick up from where John has stopped. And one thing that I want to really let our viewers know is that once you donate blood, the shelf life of a unit of blood is up between 35 and 42 days, depending on how we store the unit of blood. So then that means that blood need is a moving target. And that is why you see the Kenya National Blood Transfusion and Transplant Service on a daily move to look for more blood donors. So the idea of having so many people donating at the same time is good. Because we still have scarcity, we still have gaps to fill as a country. So therefore, we need, like I said, the patient needs to really, the unit needs to wait for the patient. Then it means then that it's a continuous activity that we need to do as a country. So coming to the process of blood donation begins quite in earnest before even a donor is identified. One of the key areas that we as an organization are looking at is to ensure that we have organized groups like the ones my colleague John is leading, so that we are able to mobilize these donors on a short notice. But again, the short notice, he mentioned something very important, that you can be willing to save a life. But because of the processes that are involved, then remember that a unit of blood after collection, before it's available for transfusion, needs to undergo some process. These processes take up to 24 hours. Yes. Okay. Our turnaround time currently we reduce it from due to the strategies that we're putting in place. Yeah. We used to have a turnaround time of up to 48 hours. That 48 hours means 2 days. And that means then that we can lose, we were losing lives because of long waiting times for blood to be safe for transfusion. But currently our turnaround time is 24 hours, meaning then that if you donate blood today, that unit of blood will be available for transfusion the next day. So I just want to walk us through now the process of donating blood. Okay. The first process in the blood service is what we call recruitment. Recruitment means identification of a population that can donate blood. Let's say an institution or a busy marketplace for people to donate blood. Then once that is done and a date is set, then that is when we send our technical teams to collect blood at that site. Okay, we call them the phlebotomy teams. So this process currently is being done digitally in terms of, we are digitizing in terms of answering to the need to be able to reach more Kenyans.
So basically you're doing this recruitment in public spaces as the monitoring and evaluation team in Kenya.
There's a recruitment team. Actually, monitoring evaluation is just an aspect of looking at the service.
So this is meant to supplement the 255 units or what the country needs?
Yeah, what the country needs, and this are continuous day-to-day work. Okay. Because the 259 that I've just given you is for the last 3 quarters of this financial year. So we are about now to complete the 4th quarter. Normally, Ayub, I must say this, that the country has experienced increased blood collection due to the strategies that we are putting in place. The Ministry of Health gives us a target of 400,000 units of blood because we have to move gradually towards achieving the national need. So we were given a target of 400,000 in the financial year 2023, and we achieved 412,000. So that means then we went high above the target that was given. So, and for this financial year, I'm confident that by the end of this month, June, which is the end of the financial year 2023-2024, we will be having units above 400,000. Because, of course, we look at all the blood units and the components that are prepared. So coming back to the process, then is that once a recruitment site has been identified by our teams, by recruitment teams, that is when we send now our colleagues who are now the phlebotomists, the nurses, and all the other guys, laboratory scientists, who are going to now collect the units of blood from the donors. So that is where the process of donor selection now begins. Like right now, Ayub, I can tell you that we have a team at the archives just in the middle of town. And that has has become one of our most important blood collection points where he did donate from. And I'm urging Kenyans who are in Nairobi to just walk in there and donate blood. We have a program. So once you present yourself at the blood collection site. Yeah. Currently, we are running a digitized service. We've digitized all our blood banks, and I can confidently say that 84% of the blood banks in the country are digital in terms of handling of blood and blood components. This way, we realize that these are a way to reach more people. Like now, his challenge of having a database of blood donors is no longer a big problem. Okay. Because as a country, yes, we have a donor registry currently that's operational. We have 284,000 donations that have been processed digitally, meaning then that we have a group of people we can actually mobilize at any given time to donate blood. Okay, so back to the point. Yes. When I give out the blood, yes, what happens next? Now, just allow me begin from that point where now you've filled in the eligibility criteria and you're eligible to donate blood. You will be ushered into to a donation room where you will where the collection will be conducted. And I heard you mention about fearing of needles earlier. And one of the things that I want to tell Kenyans is that just like any other injection, blood donation is as safe, and I don't want to say it's painless, but actually there's a small pinch you get when they are getting into your vein. And once the needle is in the vein, then the process becomes painless and smooth until 5 to 10 minutes, 5 to 15 minutes, you are done with blood donation. But the needle in terms of the size, than the other one. Of course, Ayub, the vein that we collect blood from is what we call the median cubital vein. It's a larger vein than this ones you see on this other end of the arm. For normal injections. For normal injections. So once a unit of blood is collected, and I want to say this, that you qualify through the eligibility criteria when you have hemoglobin levels above 12.5 grams per deciliter and in good health. And you must have taken something 6 hours, within 6 hours of before you present yourself to donate. My counterpart mentioned about you need to be sober at that point and not intoxicated. So that is if you partake in that. Okay. So, but now, the process takes around 5 to 10 minutes. That is the collection, blood collection. And we collect 450 mLs of blood. The unit of blood, a pint of blood, has a total volume of 450 mLs. That includes 63 mLs of what we call an anticoagulant to preserve blood in the fluid form. Remember, blood is supposed to be in fluid form for you to transfuse. Okay. Then one of the other things that I need to mention is that how much blood do you have in terms of volume? Not hemoglobin. So a normal adult who is in good health has 5 to 6 liters of blood. So that is quite a volume. And you can comfortably donate the 450 mLs without any problem. So now we have our unit of blood. Okay? Okay. Now, the next step is what we call, of course, when you donate blood, there are 2 samples that are collected. There's one for blood typing, that is for blood grouping to determine blood group. Whether you blood group A, B, O, negative or positive, that is the sample that goes to our laboratories for that process. So again, we have that sample, which we call the red top Vacutainer or the red top sample. That's for serum samples for now, infectious disease testing. All right, so that's the screening. That's the screening that we talked about. Okay. Yes, that's the screening. Okay. So in our laboratories, and the World Health Organization recommends, that's why the World Health Organization recommends a nationally coordinated, centralized blood transfusion service. Okay, then after the screening, yes. After how long is there a lifeline here, first? And then 2, does it end up in refrigeration, or it's then injected into the body of the recipient at that particular time? Okay. Yeah. Okay. Thank you. Upon screening and ensuring that we have the blood type, we have the safety in terms of the diseases that are tested, HIV, hepatitis B, hepatitis C, and syphilis, in terms of the component preparation. Remember, we said that you can save up to 3 lives through 1 unit of blood. So we have also invested in the component preparation aspects of it to ensure that we answer to the need of the patient in terms of the component they require.
Okay.
Then thereafter, we'll go to our dispatch laboratory. In all this process, the unit of blood is in the refrigerator, or the component that needs freezing is in the freezer. Okay? So at that point, then the hospital will request from us blood.
Okay.
Yeah, so the request comes from the hospital, and as we supply the blood to the hospital.
Okay, that's depending on the need on the other end.
On the need on the other
this is basically a coordination center.
Yes.
Okay. And John, because of time, let me go to John. Is paid for blood donation allowed?
Thank you for that. It's something, I guess, I mean, which is not encouraged at all. Because if it is encouraged, then we can have someone who is somewhere abducted and maybe blood is harvested from the person. You can imagine, because money is needed, I don't have blood, then there's someone there. Why don't I kidnap the person and get the blood? So it's something which is discouraged and forever and ever should not be encouraged. Because, okay, this blood, I got it freely. There's nothing I have paid God to get the blood I have. Then why should I sell the same? God himself can say, from now on, you may not have enough. So, even if he says that, what will I sell next? I have been given freely. May I give freely? And I guess also there's something, I guess, from what we talked, I can emphasize, if you let me, on the lifespan. I mean, okay, why not donate before? For example, there is platelets, plasma. Those they have a lifespan of 5 days. Those, unless you get someone who is in need, you rush there. You cannot donate them before. So that's one of the reasons. Some blood components, you have to donate them when they are in need.
Okay, thank you.
Yes.
Final question, Ruben. After how long can I again, if I donate in June 2024, after how long am I again eligible?
Thank you, Ayub. The time frame for one to donate blood differs between males and females, and men can donate blood after every 3 months, making it 4 times in a year.
Yeah.
So for females, because of the reasons that had been stated earlier by my counterpart, they donate blood after every 4 months, making it 3 times in a year. So men donate 4 times, females donate 3 times. So that is how the prescription for one to donate blood. But as a service, like I said earlier, in some of our achievements is that we've digitized and we are trying to have bulk messaging, just sending messages to donors. One of the messages is to thank you for donating blood, like the theme for this World Blood Donor Day. We're also looking at reminding you when your results are ready, because again, I want to urge our blood donors that once you donate blood, it's an opportunity to do a health check and come back for your results, because most of these infections that you test for are asymptomatic. You may not know it at that particular time when you have them. Like if you have hepatitis B, sometimes if you don't look very keenly and see whether you have yellowing of eyes, then that means you may miss up that opportunity to get treatment.
Thank you.
Yeah. So again, we are looking at portable donor data in terms of digitizing. You donate blood in Nairobi now, and maybe you're on holiday in Mombasa, and that's the time when you want to know about your results. You can easily walk into the Mombasa Regional Blood Bank and just say that I donated in Nairobi, I want to know about my results, where you'll be taken through counseling, and that result will be accessible using our system, which we call the Damu-K Blood Banking Management System. Okay.
Gentlemen, thank you so much. Your time is appreciated. Ruben Tulele is the head monitoring and evaluation, the Kenya National Blood Transfusion and Transplant Center. That's appreciated. Thank you. John Mureithi is the chairperson and founder of O Negative Kenya, a campaign that seeks to have a database on O negative blood donors, which as a result of scarcity is the move behind him forming this movement. Thanks for your time, gentlemen, as we look forward to the marking the day that will be the 20th anniversary of World Blood Donor Day, and you are appreciated for coming and sharing your thoughts here on the broadcast. Thanks to you too for waking up with us here on Daybreak, and we'll see you tomorrow morning at the same time on special coverage of Budget Day, when the Treasury Cabinet Secretary, Professor Njuguna Ndung'u, will be presenting to the National Assembly, and we'll be having a special coverage here on the broadcast from 6 a.m. with me and my colleague Safin Achieng Oma. Till then, and thanks for watching. Good morning.